good.
Santa Clarita's hometown station, AM 1220 KHTS.
I feel good.
Make sure you go to hometownstation.com for all the latest and greatest in the Santa Clarita Valley. It is the Prima Pediatrics Healthcare Hour. Dr. Feldman on AM 1220 KHTS. PrimaPediatrics.net for more information. And we were talking about the wind, because the wind has been crazy this week, and some heat illnesses, but also one thing that comes with wind and allergies and stuff is asthma.
That's right.
And asthma is, you were saying during the break, very common, right?
It's the most common respiratory illness of childhood beyond infectious causes. And it's funny. We have a saying in pediatrics, when the winds are blowing, it blows all the asthmatics in. I mean, if we see the winds are high, we say, okay, leave about a bunch of slots open this afternoon. They're all going to come in for treatments.
Yeah. Okay, so what are the symptoms? What do we need to know about asthma? What's the deal with asthma?
Well, it's interesting. A lot of parents of kids with asthma are either never told, are never told that it's asthma. Oh, he gets recurrent bronchitis, or he coughs when he runs, that kind of thing. It's asthma. Okay. Now, asthma is known as, quotes, reversible airway disease. In other words, the bronchial tubes squeeze down, they obstruct the airflow, the kids wheeze. When it opens back up again, they stop wheezing.
Okay.
So, what's the big deal about it? Well, the big deal is number one, if it stays closed down, that's a problem.
Yeah, that's bad news.
Number two, it turns out that asthma isn't an exactly completely reversible disease.
Okay.
If you don't treat it and treat it well and treat it vigorously early on, it can cause chronic airway changes. And that is something that really wasn't known until the last 3 to 5 years.
Really?
Yeah.
Explain what chronic airway changes means.
You get remodeling of the airways if you're not controlling the asthma well, such that the bronchioles are always squeezed down at least a little bit, and there's too much mucus there. After a while, because of the way the air actually flows into the bronchial tube, it changes the shape and the amount of muscle, smooth muscle that's in the bronchioles, because you're changing. It's a mechanical force.
Okay.
So just like if you have a wind blowing at a direct 90-degree angle against the piece of metal, after a while, metal's going to bend.
Okay.
And that's exactly what happens with the bronchioles. So if it's not treated properly and vigorously, asthma can become irreversible. You get airway remodeling. So the idea is, the latest concept is, don't let it get there.
Yeah.
So what's the important thing to do? If your kid is coughing, first of all, if your kid is a known asthmatic, the minute they get a runny nose, more than a day, even without cough, put them back on their inhalers.
Okay.
Because you may not hear the wheezing, but it's going to be there. Because anytime you've got stuff dripping in the back of the throat and dripping onto the airway is going to start to squeeze.
Okay.
It's an irritant. You don't want that to happen. If you know your child gets wheezing and or cough whenever the winds are blowing, don't wait for them to start coughing or wheezing. If the winds are blowing hard, prophylactically in advance, give them some albuterol or whatever bronchodilator you have for them. Make sure that their airways stay open so that they don't shut down so much you can't get them open. If your child has more than on one asthma attack per month, they need to be on inhaled steroids.
Oh, wow. Okay.
Because if you're doing more than one asthma attack a month, you're not under control.
Okay, so an asthma attack, what happens during an asthma attack?
They start to wheeze and cough.
Okay.
They have troubles breathing.
Okay.
And so the problem is if your kid's getting an asthma attack more than once a month, it means the airways are not under control.
Gotcha.
So the idea is what you do is inhaled steroids. And what that does is it reduces the inflammation, because not only are these airways squeezing down, they're squeezing down because they're getting swollen.
Okay.
And they're producing a large amount of mucus. You have to stop the swelling and the mucus production, too. If you don't do that, they're going to stay chronically closed, and then there's going to be remodeling. which you don't want to do.
That's bad news bears.
So if your doctor, your pediatrician, is not suggesting steroids, inhaled steroids, and by the way, inhaled steroids sounds horrible, but it's not the kind of steroids you take to make you have more power on the court. And it also is only inhaled. It goes into the lungs, doesn't go anywhere else. So you don't have any of the side effects that you would with oral steroids or injectable steroids.
Okay.
So that makes it a lot easier to do. But if your doctor's not recommending steroids and your kid has been getting at least an asthma attack a month for more than 3 months, then you need to ask them for a referral to an allergist or a lung doctor.
Gotcha. Okay.
So those are the things to do. But be proactive.
So what are some of the things that parents need to look out for if symptoms or something that maybe he does have asthma? What are some of the things?
If the cough is persistent for more than 2 to 3 weeks.
Okay.
You got to start thinking about it, especially if there's a family medical history.
Okay.
If there are other family members who have asthma and your kid's coughing for more than 2 to 3 weeks, they probably have asthma.
Okay.
If they've had pneumonia more than once, they may have asthma, or they could have anything else. But anything that's going to predispose them to getting loads of respiratory infections. Cough is the big one. Difficulties breathing is another one. Change in voice is another one.
Oh, really? Okay.
Yeah. Because if you're getting a change in voice, it means your voice box is getting swollen. Well, that's the top part of the airway.
Yeah.
So you got to think about it.
Okay. And this is if it persists for a couple weeks, you said?
Right.
Okay.
I mean, or if acutely your kid starts to wheeze and cough and starts using all their accessory muscles, meaning they're using the muscles that between the ribs, and they're using the muscles underneath the rib cage, and they're dipping in at the top of their throat.
Okay.
That means they're in respiratory distress. You better get them to the doctor now.
Oh, okay. Don't wait for that.
Because you don't wait for them to get so sick that they turn blue.
Yeah.
Not a good idea.
Yeah, that's bad. Yeah. Blue kids are always bad.
Yeah, unless they've been painted blue in paintball.
Exactly. Yeah, there you go. There you go. Okay. So those are some things to look out for. Just a couple more minutes here. How do we want to wrap this up?
Well, this is the way I look at it. Asthma and allergies go hand in hand. And they're present at this time of the year regardless. This is the height of the allergy season because this is when all the poppies are blooming and all of this other stuff. If you then add in heat and wind, you just make it that much worse. So if your kid is running around being great and being fine and being normal, has their normal amount of energy and they're not coughing and they're not getting a runny nose, you're fine. But if they're doing like you just did, if they're coughing and clearing their throat and they're getting hoarse like that, and or they've got a continuous runny nose with a cough, and it's going on for more than a few days like a cold would, then you need to be proactive. If they've got asthma meds, you need to use them. If you don't know how to use them, at what point, you need to get an asthma action plan from your doctor.
Okay.
The asthma action plan, which uses a little, it's a sort of a pulmonary function test. It's called a spirometer. You have the kids blow into it, and you take the best of their 3 tries. And you do that on a regular basis when they're doing well, so you know what their norm is.
Oh, okay.
And then there's a red, a green, and a yellow. And whatever they blow is what determines which and then there's a set of instructions. If it's green, you do this. If it's yellow, you do this. If it's red, you do this. If your kid has asthma and you don't have an asthma action plan, you're not with the right doctor.
Okay. So be proactive. We only have about 30 seconds here left, but be proactive when it comes to this stuff, not reactive, because reactive, it could be bad, right?
Reactive means that you're already behind the 8 ball.
Yeah, excellent. Doctor, always fun to do a show. This has been the Prima Pediatrics Healthcare Hour. PrimaPediatrics.net for more information. Thanks, Doc. Appreciate you stopping by.
No problem.
And Friday Matinee is coming up next on AM 1220 KHTS.